just wanted to talk a little bit about brachycephalic dogs, which are the little short-nosed dogs that we see tons of here. And so by definition, that's exactly what brachycephalic means. It means short-headed dogs, actually, is what it breaks down to. And so these are just some examples here with the really extreme brachycephalic dog on the top of the left-hand picture, and then a much more normal German Shepherd or something like that on the bottom skull, and then just in different directions on the other screens. And you can see how, I mean, these are abnormal animals. These are not. These are man-made abnormalities. These dogs are nowhere near the wolves that they came from, for sure. And this is to compare with what we call mesocephalic dogs, which are the most other dogs. And dolichocephalics is a term that's sometimes used for dogs like the collies that have really, really long noses, which are not entirely normal either. And so this is an excellent example on the right of a big old English bulldog. But there's lots and lots of breeds that we see a lot of on this list. So both types of bulldogs, the English and the French at least, fall into this category, are pugs, which we see probably 5 of a day. Boston Terriers, which we have a couple of nice examples of over here. The Pekingese, the Cavaliers, the Shih Tzus, the Lhasa Apsos, the Japanese Chins, Brussels and Charolais. We sometimes forget that boxers probably fall in that category as well, although they're not as extreme. Cats can be brachycephalic too. Our Himalayans and our Persians that we also see often fall in that category, and there's just examples of the extreme nature of some of the cats on the right-hand side. In fact, the top one is a brachycephalic cat, but he actually has a nose. So he is a Persian or a Himalayan there, but he actually can breathe and may not snore that badly and is much safer. Whereas the more extremely bred cats, like the one at the bottom, that are used for showing, they can barely breathe. They tend to blow bubbles out of their nose a lot. So it is kind of sad. Okay. So these dogs and cats are sometimes called flat-nosed or smush-faced kitties. This is a man-made genetic malformation. These are not accident. These cats did not grow in the wild. These dogs are not closely related to wolves. These are man-made specific breeds made to look like this on purpose. It makes these breeds what they are, and you can't really have a pug without it having a smush face, or it's not going to be a pug anymore. But there are certainly more extreme individuals of the breed. And when the more extreme ones are unhealthy, this is not a normal face conformation at all. Their jaws are extremely shortened. In fact, the bulldogs tend to have an underbite, and some of the other ones as well. Their noses are short. They tend to have big, wide foreheads. And all these normal structures are now made to fit into a shortened jaw. This causes problems. Oh. It causes eye problems, for starters. How cute is that, right? But these dogs have big, bulging eyes, and as big as their eyes are, their eyelids are still too big for them. They often don't close their eyes the way that they should. Their tear film that we all have covering the surface of our eyes sometimes doesn't spread to the middle of their corneas because their eyelids are so big, so they'll actually end up dry in the middle. Additionally, dogs like this cute little pug here often have a mild entropion, or rolling inward of the hairs on the middle lower eyelid to where they touch the cornea and rub on it. And this is one of the potential causes of things like pigmentary keratitis that we see in this breed. All these dogs and cats tend to have decreased corneal sensitivity, meaning it doesn't hurt them as much when something gets in their eye or touches on their eyes, which might account for them being brought in later in the disease process because they don't complain as much, and also may mean that they don't blink or protect their own eye as much and are more likely to have problems. Some of these dogs, not all of them, have a nasal trichiasis as well, which happens when those nasal folds that you can see kind of coming on each side of this dog's face, those hairs grow long enough and they'll actually can touch on the eye and rub at it. This isn't really what we're here to talk about today. We're going to talk more about the respiratory complications of brachycephalic disease. But needless to say, the reason that we see tons of these dogs is they do have a lot of eye problems. Among the things that all those anatomical abnormalities contribute to is chronic keratitis of any sort, pigmentary keratitis, especially in pugs and Pekingese, corneal ulcers, and in cats, corneal sequestrum. So this has been called brachycephalic airway obstructive syndrome, brachycephalic syndrome. And for the respiratory disease to be considered present, at least one of these things is present in the dog, and that is either stenotic nares, an elongated soft palate, a hypoplastic trachea, and everted laryngeal saccules, which we're going to talk about. So all of these dogs tend to breathe noisily. They snore. They're exercise intolerant to greater or lesser degree. They stress easily sometimes. And the most extreme dogs occasionally even will pass out from their lack of oxygenation. But how cute is that? This is what is meant by stenotic nares on the right. It's the actual opening to the nostril that's shrunken. And it can be a lot more severe than this as well. You'll probably start noticing this if you look at our pugs and peaks and things as they come in. Very often, they barely have enough room to pull oxygen in through that opening. It can be corrected. And this is an example here, in fact, of a dog that's being corrected, not at the ophthalmology clinic, but by a surgeon. And on the left, that's a very extreme version of stenotic nares. And on the right, the blood indicates where surgery has been done, and they've actually cut out the little section of the covering there to open things up a bit. This is an example of a dog's soft palate, just so you know anatomically what we're talking about here. The hard palate, nobody has a pointer, do you?
I think one in my office.
Okay. The hard palate is actually the front half of the top of the mouth. And so toward the teeth from where that soft palate arrow is. The soft palate is toward the back. And this is more of there's no bone basically here. This is cartilage that's involved. And so, thank you. And so here is the hard palate, and then this is soft palate tissue back here. This every dog has a little tongue of soft palate back here, but in the brachycephalic dogs, that amount of area is placed in a much smaller space than it really belongs in. Here are the respiratory structures as well, kind of from the side. So in a little short-nosed dog. Here again is the hard palate, and then the soft palate back here that should sit above the opening to the larynx. The larynx, which is the opening of the trachea. And what we'll talk about in a minute can happen is this soft palate, if it's too big or swollen, can actually get in front of here and block off the ability to breathe and oxygenate. And here, again, this can be surgically corrected. So our hypoplastic, our small nares as well as elongated soft palate can be surgically corrected by a surgeon. This is, now we're kind of really deep in here with this picture. So this is the soft palate here with that extra bit that's hanging off, covering up the larynx that's here, so that this dog can't breathe very well and snores and all that kind of stuff. Over here, they've actually removed that flap to make this opening much bigger. And this is a radiograph, obviously, of a dog with a small trachea. So this is the trachea, or the breathing tube here. And you can find that it kind of becomes bigger and smaller in different places. Everted laryngeal saccules are a little bit different. All these first three things that we talked about, these dogs are born with. laryngeal saccule eversion. I couldn't find a picture of it, but this happens secondarily. So this is a normal structure that actually gets kind of swollen and then out pockets, and these structures just further get in the way of the breathing process when they develop. This is also, it's surgically correctable. They can simply be removed. Oh, I did find some, I lied. So this picture didn't actually turn out quite as well as I expected, but these are the everted laryngeal saccules. Oh no, sorry, these are the everted laryngeal saccules rather, that are getting out into this normal opening and obstructing it further. Okay, so these dogs are very heat intolerant. So this is a dog that's even more important that is not left in a hot car in the middle of summer, taken hiking when it's 95 degrees, that kind of thing. So they need to get special care. Being overweight makes their exercise intolerance even worse. So it's important to encourage clients not to overfeed their little dogs. I'm always amazed that pugs end up fat because they seem such active little dogs, but they do. And so the clients have to realize that as little as they're feeding their pug, it's still fat. And therefore they still need to feed them less. Harnesses are really useful for these guys so that they don't have something else pushing on their trachea and their other breathing structures, since they're already compromised. So why do we care? Well, the things we just talked about, client education. Even though we're not a general practice, we still get pets that aren't perhaps getting the right advice, or clients that aren't getting the right advice, or they're not understanding the importance of that advice. And so it helps for us to reinforce what the regular veterinarian has to say. Additionally, these pets are potentially under greater anesthetic risk because of their poor breathing. And although we're not always in a position to advise people about this, it is important to know that the more extremely affected individuals, although they may make good show animals, it's not very compatible for life. So at least pet owners should be advised against going in backyard breeding their cute little bulldog that can barely walk up a hill without having problems. So, and additionally, special care, we should take special care of these dogs during our exams, especially if they're stressed out, overweight, and really don't want to be here. Special care as well needs to be taken around the time of surgery by our surgical staff. So, during the exam, we want to minimize their stress as much as possible. Really what we do is not all that terrible. But it's the first time they come in, we're shining a bright light in their eye, we're holding them still, they're used to going to the vet and having vaccinations and things. Some dogs are stressed the moment they walk in the door or the moment that they got put in the car that morning. We probably need to be even more careful on hot days, and if the animal is just a particularly stressful sort. It's important to take it slow. The more stressed they seem too, the slower you want to take it. And you may even want to take breaks during the middle, do the tears, even give them back to the client for a minute, relax, then test the pressure. This is going to take longer, and not every dog, not even every brachycephalic dog needs that, but you just need to be aware that some of them are going to need that. Less restraint sometimes is more, not always, but sometimes. And if you can get away with less restraint, it's liable to make them less stressed by the whole process. Sometimes we don't have a choice, but if you can avoid a muzzle in these dogs, it's ideal because we're putting something else around their breathing apparatus, and there could be some risk associated with that. We may want to shorten the exam if it's an obvious answer. This dog has this disease. Maybe we don't need to look at the retina or do something like that if it's not absolutely necessary. We could sedate these dogs, and it seems like an obvious answer, but to be honest with you, there's several reasons that we might not want to do that. One is that ophthalmic exams on sedated pets are less than ideal to begin with. Sedation tends to cause their eyes to roll down and inward, at least extreme sedation, and then so it can be hard to even see the eye. Plus, this has a negative effect on our testing. So pressures in the eyes are going to be lower in sedated dogs. Tear production is going to be decreased in a sedated dog. So it makes it less than ideal. So it is a last resort. Why do we care? We care because if we obstruct their airway severely during the exam, we can cause things that are potentially life-threatening. Pulmonary edema is one of them, and this can result in even further compromise of their respiration. It does tend to be self-correcting, but they'll need oxygenation and supportive care in the meantime, at expense and stress to the client as well as everybody involved. So, special care related to surgery. So how well do you guys think that these dogs probably do under general anesthesia?
They love it because they have a tube down there. Finally, they've got open breathing.
I would think they do better because we're giving them what they can't do on their own.
Yeah. So the actual anesthesia part is right. You're absolutely right. They actually do well under anesthesia because they're breathing better than they ever have because they have a tube forcing an open airway, and they're being given oxygen. So it was a trick question. I'll let you guys pass with flying colors. However, the induction, the putting them under anesthesia, and the waking them up or recovery parts of it can be a bit dicey. And this is kind of somewhat equivalent to the idea that my mom instilled in me which is that the most dangerous place to drive is in the parking lot. That's when you need your seatbelt, and so many people take it off then. This is the important part, the preoperative and especially postoperative period. These dogs should be induced intravenously with drugs to put them under anesthesia. We already do this for every pet, so it's really nothing different we're doing for them. Almost every pet gets propofol intravenously through an IV catheter, and that allows us to get in and get control rapidly of their airway by placing a tube. Why else do we care? We care because the dogs that have the hypoplastic tracheas, bulldogs are notorious for this. They have smaller diameter tracheas. We need smaller tubes than they look like they should have based on their size. So it's a good idea to have choices available, including smaller than what you'd probably otherwise guess. Also, that soft palate that's there and maybe swollen or too big, the averted laryngeal saccules, all of these things make it harder to see and to place the tube properly. Laryngoscope, I like to use anyway, but not everybody does. Lots of experienced technicians I've met prefer not to. This might be an exception, that you want to use that laryngoscope not only to have the light, but to be able to pull any tissues out of the way that are necessary, so we can be sure that the tube is in. Okay, so most brachycephalic dogs probably wouldn't pulse ox or have the pulse oximetry reading of 100 on a normal day because they don't get very well oxygenated. But under anesthesia with the tube down them and on oxygen, they really should be pulse oxing something close to 100. So if they're not, then you might worry that you didn't get that endotracheal tube in properly. That you might want to go back in and check. Sometimes these dogs have slow heart rates because of high vagal tone. We already pre-medicate with drugs that ought to take care of this, like glycopyrrolate, but they could need a top-off dose, so you need to be aware of that, or atropine as well. And it's important to remember that a low heart rate may not necessarily mean that they're under deeply. Okay, so this elongated soft palate, it's already long, and the process of the anesthesia, the intubation process, and the anesthesia can result in further swelling of these tissues. They were already difficult maybe when we started out in getting the tube in, but now that we removed the tube, the soft palate could actually fall over, like I showed you in that earlier picture, and cover up that opening. Then breathing's a problem. It was already a problem, now it's more of a problem. This is where the scary part sometimes happens. You may hear a snoring sound, which is actually that tissue being moved by air. And the dog could turn blue. And what we mean by that is that the pink tissues, the pink gum tissue and tongue tissue, if it's not well, the blood is not well oxygenated that's going through there, they might turn a blue or really a purple probably color. That's not good, in case anybody had any doubts. And this is potentially a fatal problem. So it's important to keep the oxygen flowing. Go ahead and clear the lines of the isoflurane right away so he's not continuing to breathe gas, anesthesia. It's best to recover them when possible in sternal anesthesia or in sternal recumbency, which means laying on their chest so that both lungs can inflate. Leave the tube in as long as possible. We often say until he starts chewing on the tube. Now we don't want him to chew the tube and have parts of it get stuck. But we do want the dog to be pretty awake by the time that we remove that tube. This is an interesting one that we might not think about that much. We're all in the habit of, everybody that does anesthesia dogs are all kind of in the habit of maybe moving the tube around, doing things to stimulate the dog so that they wake up as soon as possible so we can go to lunch. This might not be the dog that is best to do that in, because you can stimulate them into swallowing, but that doesn't necessarily mean that they're wide awake. And what you don't want to do is to fool yourself into thinking the dog's awake. Take out the tube, and then have him go back to sleep on you, to where he doesn't have those reflexes as well as he did before. I'm sorry, as well as he should, rather. Okay, so again, watch these dogs very, very closely in the post-operative period. We probably want to keep their IV catheters in a little longer than we would in any other dog. And if there's any doubt about oxygenation or breathing, get a doctor. Very often, especially if we do see the gums that are not the proper color, we'll intubate again. And then we'll go through the whole process of, again. This may take some propofol again through the IV catheter that we left in to get them asleep enough to put the tube in so that they're breathing okay. We want to have oxygen there, obviously, and those smaller than normal endotracheal tubes available. Sometimes we might administer steroids if we do think that swelling is part of the reason, swelling of the soft palate tissues is part of the reason this is happening. And then we have to go through the whole recovery process again because we've given them more propofol. All right, one of the reasons that we want to make sure that the dog has recovered all of the reflexes by the time that we take that tube out is that one of the issues can be aspiration of regurgitated food into the lungs. The larynx normally closes to protect the airway from food and liquid during swallowing, but that's a reflex that anesthesia suppresses. And so if that reflex is not further back and the dog regurgitates food into its mouth and then breathes, and some of that gets into the lungs, they can get pneumonia, and it's called aspiration pneumonia. That it may be an infection, but it also just the chemical process of all of that acidic stuff getting in the lungs is not good for it at all. If it's suspected, we'll always place the dog in sternal recumbency, again that's laying on the chest, and pull him to the edge of the table and lay that head off so that gravity helps that material to flow away instead of toward the airway. And then we're going to let the doctor know, and together we're going to clean out the oral cavity as best as we can and dry it. If the dog's still intubated, we're going to want to leave that tube in, again, as long as possible, maybe even longer than before. Sometimes we'll leave that cuff, which is what makes the tube fit airtight, just a little bit inflated so that when the tube is pulled out, it'll pull any material with it, hopefully. But this is something that the doctor will decide. And then we might want to send the dog home, especially if there's a big suspicion of aspiration with antibiotics orally. Okay, so only in very severe cases, and this doesn't happen very often, but if there's a severe breathing problem, we might have to do a tracheostomy or the ER clinic may have to do a tracheostomy, and this means to open up the airway from here. Everybody's probably seen this on some television show. It's usually with a big pen or something like that to hold the opening over. They do make also medical grade items that do that and hold it open, and it's an emergency thing only. This is very rare for anything to be this bad, but sometimes we will want to send them for monitoring overnight at an emergency clinic since we don't offer this. Okay. Any questions so far? Okay. So a little bit on bulldogs because they are a little extra subcategory of brachycephalic dogs. These are big brachycephalic dogs, and that's one of the biggest differences. We're usually talking pugs, Pekingese, Cavaliers, you know, all these little toy breed dogs, but these are big dogs. And they're really prone to extreme brachycephalic features, but especially hypoplastic tracheas. Not all dogs, not all brachycephalic dogs have this, but probably the majority of bulldogs do. They're also tend toward the obese. Even a normal bulldog is a pretty big dog, but they tend to get overweight pretty quickly. And we're literally looking at part of the problem under anesthesia, besides the hypoplastic trachea, being that their lungs are getting compressed by weight. Both normal weight, which is more than the big dog, than the little dogs that we're talking about, but sometimes obesity, outright obesity. These dogs do a little better if their procedure can be done in sternal recumbency. Fortunately, we're often looking at cherry eye procedures and eyelid procedures, which can. They're worse off when they lay on their sides because then one lung is compressed. Yes?
What's that dog wearing?
Looks like a bra, doesn't
I
it?
don't
Looks
know.
like a
It's
bikini
probably
top.
it's probably it's a girdle.
No, it's bikini.
I don't know.
Yeah.
I blatantly stole this off the internet. I cannot tell a lie. And this is actually, if anybody has any horse experience, this is why horses don't do so well. One of the reasons horses don't do so well under anesthesia is their sheer weight compresses their lungs and makes it hard for them to breathe. So think of them as small horses. Let's see. They're also at a particularly high risk of aspiration pneumonia for one reason or another, and this is really a serious condition, which is life-threatening. This is the rationale behind our protocols, our anesthesia protocols for this breed, which requires fasting of them for a full day instead of just from the night before. And this should be explained, the fact that it's potentially life-threatening, not to mention expensive, and often requiring 24-hour hospitalization, is something that might be worth explaining to the clients that you think might be resistant to the idea of fasting their fat bulldog for 24 hours. Nobody wants to look at their dog starving, but it's one day of their life, and it's worth it if it protects them. And this is an example of a beautiful non-brachycephalic dog. I know, right? Any questions?
No, that's very
Thorough?
Yeah, very
Great
good.
presentation.
Yeah.
Long story short, leave the catheter in longer.
Leave the catheter in longer.
And the
exactly.
tube.
Oxygen
And the
longer.
tube.
And the endotracheal tube longer.
Did you have any
As-
thoughts for examinations? Because that very often can be a
Yeah, I
problem.
did have that in a page or two in there about that, about reducing the stress as much as possible, taking breaks, trying not to use a muzzle.
Well,
If you can
sometimes
help
when
it.
a dog is struggling, you think he's resisting because
Yeah.
he's just being a bad dog. But very often
Yeah.
they get into a panic mode and they're struggling because they think they're going to die.
Right.
You know, so there's something
That's a
about
good point, too.
recognizing the difference.
It's a
Yeah.
very good point. And you can look at their gums in the exam room too.
Yeah.
And if they don't look good, then that's a good point.
Yeah.
Absolutely.
No, it's really
Anyone
good.
else?
Thank you.
Anyone else? Okay, thank you.
Yay!